Well, Israel's relentless bombardment has forced Gaza's healthcare system to the brink of collapse. More than 77,800 people have been injured since the onset of the military campaign in October. Only 6 of the Strip's 36 hospitals are functioning, and only partially. The health ministry has recorded 1 million cases of infectious diseases, and more than a quarter of Gaza's 2.3 million residents are on the brink of famine. UNICEF estimates that in northern Gaza, 1 in 3 children younger than 2 is malnourished. We have with us James Smith, who's a British doctor who traveled to Gaza with medical aid for Palestinians between December 2023 and January 2024, joining us from London. Welcome to Al Jazeera. We appreciate your time. If we start with the latest developments, look, there was a recent attack in central Gaza just a few hours ago. We're hearing that 36 people were killed because of bombardment on a family home. And these people, the dead and the injured, have been taken to Al-Aqsa Hospital. And that is where you worked, I understand, during the months that you were in Gaza. From what you've seen, is Al-Aqsa Hospital able to cope with bringing in more injured people? How is the hospital dealing?
I mean, I think what we need to remember is that the health system collapsed in Gaza back in late October of 2023, and it hasn't recovered since. And that's because the supplies, the resources, the specialist staffing and so on required have either not entered into Gaza, or where such sort of commodities and resources have been made available, it's impossible for people to work in a context of such extreme violence and insecurity. The hospital is barely able to cope. I heard from a colleague yesterday who wrote a very short message to me, and he simply said the situation is catastrophic. They have very, very limited means to provide care to patients, and patients are presenting with some of the most horrific trauma-related injuries and also non-trauma-related healthcare problems that I have ever seen.
Like what? I wonder if you can just elaborate on what you saw.
So we would see children and adults on a daily basis, often multiple times a day, with severe multi-trauma related injuries, often children with traumatic amputations of more than one limb, children and adults with horrific full thickness burns. All of these trauma-related injuries require prolonged specialist care, which simply isn't available at the current time. At the same time, we were seeing hundreds of children presenting to the pediatric department every day. This was back in early January. Children with diarrheal illnesses, complex respiratory problems, all sorts of conditions that, again, require immediate medical intervention.
And whilst you were there, what sort of aid did you see come into Al-Aqsa Hospital and perhaps other areas of the Gaza Strip? And you mentioned a moment ago that you were in touch with a colleague just yesterday from Gaza. Are they telling you about what sort of aid is now coming into the Gaza Strip?
So I haven't heard this from colleagues directly, but certainly during my brief time in Gaza, aid was minimal at best. As viewers will know, there hasn't been a day since October 7th that we've come anywhere near the requisite 500 trucks of humanitarian aid. Need has increased so exponentially in that time that we're talking about thousands and thousands of trucks that are required on a single day to bring in clean water, nutritious food, essential medical supplies, shelter, and so on. We saw trucks parked up in Rafah for the better part of a sort of half kilometre to a kilometre, unable to cross or waiting to cross. And on occasion, we would see very, very small convoys of trucks moving from the south towards the north of Gaza. It wasn't clear where they were going, but it was clear that the volume of humanitarian assistance they were carrying was negligible at best.
And in terms of, I mean, you know, we speak to people over and over again from the Gaza Strip and doctors like yourselves who just say that hospitals need absolutely everything at this point, but from what you saw, what's most desperately needed for the hospitals to be able to function?
What's most desperately needed, first and foremost, is an end to the violence. And healthcare and humanitarian workers have been consistent about this from the outset. That there's a saying that was particularly prominent during the Rwandan genocide, which goes that doctors cannot stop a genocide. So you can resource a health system to a state of almost perfection, but you cannot adequately respond to the needs of the people under these current conditions. We have healthcare workers, Palestinian healthcare workers, that have been working under these conditions for more than 5 months now. They are completely exhausted. Many of them are profoundly traumatized. They're also trying to look after their families at the same time. We need additional medical support. We need staff to work alongside them and to be directed by them. We need essential commodities. At times, we're talking about the absolute basics. Surgical gauze to clean and pack wounds, simple analgesia to treat pain. As you've mentioned, we're talking about absolutely everything that is needed at the moment in order to maintain the most basic level of functionality.
And let me just ask you one final question while I have you with us, James Smith. I mean, we see now the U.S. and other countries sending aid by sea, building that pier off the coast of Gaza. We've seen these airdrops that have taken place. Do you think that they replace the need for access to Gaza by road? And what's your reaction to these moves?
No, they absolutely don't replace the need for access via road. This is a perverse distraction, and no humanitarian organization should play into this. We're talking about effectively a humanitarian alibi, whereby ongoing political neglect, ongoing military violence is disguised with the sort of the bare minimum of humanitarian support. It's not even worth discussing this, and really we need to be pushing, one, for an end to the violence, and two, for the most significant surge of humanitarian support by land into Rafah and via other means as soon as is possible.
Okay, James Smith, we thank you so much for joining us from London and giving us your perspective. Thank you.